I think there are two things. One is recognition of what kids are struggling with, and two is working where the kids are. So I've mentioned this problem of access, right? We cannot wait till the kids necessarily come to us. We may not necessarily can wait for the referral from the pediatrician, but we can go to where these kids are, which is our schools. But let me address the first issue, recognition. Um, Stress really operates in an inverted U-shaped curve, right? If we have no stress at all, that's a problem too. If we don't care about that exam we're going to have tomorrow, we'll probably fail. So the more stress we have, the more vaccinated, if you will, we become to traumatic stress when stress happens. So as stress goes up in that curve, we perform better, our health is better, just in the same way that the immune system activates when it's stress, but only to an optimal point. After that optimal point, what we see then is the decline of the health, of the performance, of the well-being of the individual as stress accumulates. And it is there where traumatic stress occurs. And it is important for physicians to recognize that we are not talking about the motor vehicle accident in which they were involved last week. We're not even talking about the earthquake or the other natural disaster that may have happened, but we're talking about the whole backpack that the child carries. We all carry a backpack with all of our experiences, all of our stressors accumulated. In the literature, we call this the allostatic load, right? The physiological cost to the body of all the summation of all the experiences. And many times when we force a kid or to talk about like one issue, they feel that they shouldn't be talking about all the other issues. So it is important to really, as I mentioned before, have communication open so that the kid can talk about all of the experiences that they may have experienced or that they may be dealing with chronically. So the recognition of the child's experience is an important piece of this. And in many ways, we can carry backpacks, right? In many ways, there is resilience there. But one big misnomer is that kids are resilient by virtue of being children. There's nothing in the scientific literature really that supports that. In fact, what we see is the opposite. Children are more at risk. Children are more vulnerable. That's why we take care of them. But we can give them opportunities to become resilient. We can cultivate that resilience. And better than resilience, we can really help them adapt to new changes in their environment. Resilience is a physics term, right? It means that you bounce back to where you were. If we can bounce back to a better place, that's even better. And that is the process of adaptation. And but none of this happens if we don't know the context, if we really don't understand what the kid is struggling with or what their triggers are. And many times, families, schools, teachers, doctors may be missing that context of the child. And the child may not be able to put it together. The children tend to compartmentalize. They may know that they have an experience. They may know that they have some symptoms or feelings, usually fear, sadness, and anger when they relate to trauma. And they may know that they do some behaviors that get them in trouble. But they don't see the connection between these three. They don't see that because they have this backpack or traumatic events, they feel this way that makes them behave in a way that gets them in trouble. So the first thing we can do is provide education. Many children feel a lot of relief when they know that they are not the only ones that develop symptoms after something bad happens. So just this universality of the human response can be quite helpful and can help children know. Usually we want to jump to know what's in the backpack, tell me about what happened. But the reality is that we shouldn't jump to that right away. We should actually educate, inform, about how the human normal response to trauma is. And then after that, we should really examine what's there in the child in terms of support systems and coping skills. It's a very personalized experience, the experience of trauma. So each child will need to create their own toolbox, which is what we do with our treatment. Our treatment is called Q Center Therapy, and you can read more about it on our website on the Early Life Stress and Resilience Program. But the first steps are those, are education, assessment of the support system and their coping skills, and then the building of a toolbox, even before you get into the narrative of what happened or what's in the backpack.